Jaden McDaniels suffered an ankle injury earlier in the week, and sources have come out and said that he's actually dealing with a grade 1 ankle sprain. For today's video, I want to focus on the relevant anatomy for an ankle sprain, as well as the grading system, and finally what they should expect when they go to rehab. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo, and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. If you like this sort of content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future. Now let's go ahead and take a look at the injury video. So we see here that as he steps, that right foot is just going to land very awkwardly and he's going to roll it inwards. Here I have a model of the foot and ankle, and so the ankle joint is formed by two long bones coming down to form either side of it. The first one being the tibia, also known as the shin bone, that's going to come down and form the medial malleolus. Then as we come out here to the outside, we have the fibula bone that's going to come down and form that lateral malleolus. And finally, as we look on the inside here, we have the talus bone. And all three of these bones together make up what we know as the ankle joint. There are four major motions at the foot and ankle. The first one being dorsiflexion, where the foot is going to come up like this. The opposite of that is going to be plantar flexion, where the toes and foot are going to be pointed downward. Then as we flip the model here, we have inversion, where the foot is going to be coming inside like this. And finally, the opposite of that is going to be eversion. In the injury video, we see that as his foot comes down, it's going to land awkwardly and put his foot into a lot of inversion. And that's where we start to talk about all those structures that are located laterally or on the outside portion of the ankle because they get stressed in this position. There are three ligaments out here that contribute to ankle stability. The first one being the anterior talofibular ligament, or the ATFL for short. Anterior meaning that it's towards the front. Talofibular, meaning that it's attaching the talus and the fibula together. Then as we slightly come on down here, we have the calcaneofibular ligament, where essentially it's going to be calcaneofibular because it's attaching the calcaneus and the fibula together. And finally, as we go towards the back portion of the model here, we have the posterior talofibular ligament, or the PTFL for short. Posterior meaning back, and talofibular once again because it's attaching the talus and the fibula together. Anytime a person is going to go beyond their norm range of motion for that ankle inversion position, they have a risk of damaging one or several of these structures located laterally on the ankle. They also are at risk for a fracture, but in this case, we already know that he's had imaging and they've essentially diagnosed him already with a grade 1. We'll go over the grading system in a moment, but I do want to go over essentially a test we can do to determine if somebody is dealing with a lateral ankle sprain. And this is essentially known as the Taylor tilt test. So what we're going to do, we're going to stabilize the person's foot and we're going to place them through inversion. We can differentiate a little bit based on what ligament we think is involved here by basically varying the position of the foot. So if we place the foot in a little bit more plantar flexion and put it in inversion, this is going to stress more of that ATFL. As the foot is more in line of a neutral position, that's going to stress more of the CFL. And finally, if we dorsiflex the foot a little bit and then go into inversion, that's going to stress a little bit more of the PTFL. Also, the person is going to point specifically where they're having pain on the lateral ankle. That also helps us differentiate what ligaments being affected. The gold standard, of course, is the MRI, and that's where we get the grade system 1, 2, and 3. In a grade 1 ankle sprain, this is where you're getting stretching of the affected ligament. In a grade 2, this is where you're getting some partial tearing. And finally, in a grade 3, this is where you're getting a full rupture. The best case scenario, of course, is the one that we've already found out in this case, a grade 1. This is because there is no tearing at all of the affected ligament. Usually in grades 2 and 3, this is where you're getting some ankle instability, and a lot of times this can require surgical intervention. So anytime we get somebody in the clinic with a grade 1 ankle sprain, immediately what we're going to do is follow that acronym RICE, where R stands for rest, I stands for ice, C stands for compression, and E stands for elevation. Then we're going to work on that person's range of motion and get it as identical to the other side as possible. And then after that, we can start working on strengthening and finally sport-specific movements. Usual timeline for recovery for a grade 1 ankle sprain is anywhere from about 1 to 3 weeks. In this case, sources are saying that he should miss anywhere from 2 to 3 weeks, so that seems to be on par with what we would see in the clinic. So we wish McDaniels the best of luck moving forward. This is the most ideal situation for this injury. If I happen to hear any updates, I'll be sure to update everybody on the comment section. And also, if you happen to hear anything, please feel free to update us as well. Thank you once again for tuning into my channel today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can go ahead and see some of the other injuries that I've essentially talked about. Thanks again for tuning in, and I'll see you next time.